ශ්‍රී ලංකාවේ ප්‍රථම වරට SLT 4G වෙතින් දැන් PO TV නරඹන්න. ඉදිරියටම ගෙන යන SLT 4G.
ලෙන්ගතුකම වැඩි කරගන්න ලව්ජු රුපියල් 50ට අඩු කළා.
මාමේ එන්න අපිට
A dark day. Sri Lanka records its first COVID-19 death, along with 7 new positive infections of the virus. Curbing a pandemic. Over 1,000 people arrested as police ramp up crackdown on curfew violators. Get on the books. Arrivals from Chennai within the last 14 days urged to self-quarantine. Surging fatalities. The world sees its deadliest day since the COVID-19 outbreak began, with close to 1,000 people perishing in Italy in one day. All that and much more coming up on First at 9. This Saturday, the 28th of March, 2020.
From AdaDerana, this is AdaDerana First at 9.
69.97ට SMS කර රුපියල් මිලියන 3ක මුල්තැන්ගේ උපකරණ දිනාගෙන අවුරුද්දෙම කුස්සිය ටයිම් සේව් කරගන්න.
ඔබේ ආරක්ෂාව රටේ රැකවරණයයි. Sri Lanka Insurance.
Live from Studio 24 in Colombo.
Good evening. This is First at 9, your English news service on AdaDerana 24. As Italy faced its darkest single day in its COVID-19 battle with a staggering 969 deaths in the last 24 hours, Sri Lanka's health authorities reported the country's first local COVID-19 death today, 17 days after the first case was recorded. The patient was a 60-year-old resident of Maravilla. Reportedly, he was already immunocompromised, having undergone a kidney transplant and taking treatment for diabetes and high blood pressure as well. Meanwhile, Director General of Health Services Dr. Anil Jasinger revealed that most of the new cases were arrivals from Chennai in India and pleaded for any recent arrivals from the destination to contact health authorities and immediately commence self-quarantine protocols.
Sri Lanka's first local COVID-19 death was reported today at the National Institute of Infectious Diseases in Angoda of a 65-year-old man from Maravilla. The victim had earlier undergone a kidney transplant and suffered from other complications such as diabetes and high blood pressure. Authorities reported 7 new COVID-19 cases this afternoon, bringing Sri Lanka's active COVID-19 patient numbers to 103, with 9 patients in total making full recovery so far. The latest recoveries reported were of 2 patients, one from the IDH hospital in Angoda and the other from the Valikanda base hospital. Currently, a further 190 suspected cases are under observation at 21 hospitals across the country. This is a drop of 39 cases from yesterday's reported total of 238. Following the country's first confirmed COVID-19 case being identified on 11th March, the number of cases has seen a steady rise in the 17 days since. However, a minor spike in new cases were noted between 17th and 19th March, but health authorities have reported significantly lesser numbers from that period onwards. No new cases were reported on 25th and 27th March. From the total of 103 active cases, 86 are currently being treated at the IDH, 9 at the Valikanda base hospital and 1 at the Mulleriava hospital. Meanwhile, Director General of Health Services Dr. Anil Jasinger revealed that among today's 7 new cases are recent arrivals from Chennai in India and urged any member of the public who had travelled to Sri Lanka from Chennai in the last 14 days to immediately inform authorities and enter self-quarantine.
අද දින රෝගීන් 4 දෙනෙක් වාර්තා වෙලා තියෙනවා. ඒ අනුව අද සම්පූර්ණ රෝගීන් සංඛ්‍යාව 110ක් බවට පත් වෙනවා. අද දින මේ රෝගීන් 4 දෙනාගෙන් 2 දෙනෙක්ම ඉන්දියාවේ චෙන්නයි සිට පැමිණි 2 දෙනෙක්. ඒ වගේම මේ දින 4-5 කාලය තුල තව 2 දෙනෙක් චෙන්නයි සිට පැමිණිලා තියෙනවා. ඒ ඔවුන් කොවිඩ් රෝගීන් හැටියට හඳුනාගෙන තියෙනවා. මේ නිසා මම ඉල්ලීමක් කරන්න කැමතියි. යම් කිසිවෙකු පසුගිය දින 14 තුල චෙන්නයි ඉන්දියාවෙන් පැමිණිලා තියෙනවා නම් කරුණාකරලා ප්‍රදේශයේ මහජන සෞඛ්‍ය පරීක්ෂක එහෙම නැත්නම් සෞඛ්‍ය වෛද්‍ය නිලධාරීතුමාට දන්වා අනිවාර්යයෙන් නිරෝධායනට ලක්වන්න.
One of the last confirmed cases identified was an individual from the Atalugama village in Bandaragama, which prompted health authorities to isolate and monitor the community using quarantine protocols. Meanwhile, 2 family members of the Bandaragama patient have been admitted to the Nagaur General Hospital for medical observation today after displaying symptoms consistent with COVID-19. Following this, 26 individuals from the Atalugama village who had come into contact with the patient have been placed under self-quarantine and are being monitored by Security Forces personnel. Meanwhile, 2 doctors at the Sri Jayawardhanapura hospital who treated a patient who was later found to have contracted COVID-19 after being discharged have been placed in quarantine. The patient at the time of admission to the hospital had concealed the fact that he had recently arrived from abroad. It was further revealed that the patient had discharged himself against physician's advice and admitted himself at a private hospital afterwards, where tests had uncovered his COVID-19 infection. Further, it was revealed that the patient had been treated at the Sri Jayawardhanapura hospital by 2 medical staffers who were his grandchildren, who themselves had concealed information regarding his travel history. Director of the Sri Jayawardhanapura Hospital, Dr. Ratnasiri Hevage, said that since the 2 doctors had provided treatment to the patient following proper safety procedures, there was no necessity to shut the hospital down. The police special task force, in a precautionary measure, was seen disinfecting the hospital premises today. Meanwhile, following revelations of an attendee at a Muslim religious gathering at the Red Mosque in Colombo Fort having been diagnosed with COVID-19, the Muslim Religious Affairs Council offered a clarification on the subject, stating that no further religious events were held at the mosque since the 13th of March. However, upon further investigation, it was discovered that the patient in question had attended an event at the location on 13th March and was only diagnosed on 23rd March. The police are carrying out an investigation to determine if this individual, who had arrived from Virginia in the United States, had concealed crucial personal information from the authorities. A building at the National Institute of Infectious Diseases constructed by the Sri Lanka Air Force was handed over to hospital authorities today. The building is to be used for the secure treatment of COVID-19 patients. Meanwhile, the Homagamba Base Hospital has been using robotic technology to aid in the treatment of COVID-19 patients. The hospital was earlier earmarked and developed to specifically handle COVID-19 patients by the government. Further, a member of the nursing staff at the Kandy National Hospital has built and improved an artificial respirator, which is to be handed over to health officials for the treatment of the country's COVID-19 patients. Meanwhile, medical supplies donated by the Chinese government arrived in the country today on board a special Sri Lankan Airlines flight. The donation includes 50,000 face masks for healthcare personnel and other essential medical equipment. A further stock of equipment is expected to arrive on Monday, the 30th of March. In the meantime, another group of nearly 300 Sri Lankan nationals who arrived in the country and underwent the government's mandatory 14-day quarantine process left for their homes today from quarantine centres across the country. Army Commander Lieutenant General Shavendra Silva said that the individuals have been requested to follow a further 14-day self-quarantine at their homes after their release. 2 Belgian tourists holding in Kalpitia and a group of South Korean factory technicians in Dankotur received certificates from health authorities after completing 14 days in self-quarantine. In Kalutara, special task force personnel discovered a duo from Russia today walking along the streets during the curfew period. The duo had been self-quarantined in a hotel in Kalutara South, but were forced to leave the lodgings due to objections voiced by residents in the area. However, with the assistance of the Kalutara Public Health Inspectors and personnel from the Kalutara South Police Station, the duo were transported to a hotel in Valigama to continue their self-quarantine. Meanwhile, health officials have requested the public to delay vaccinations for a 2-week period and avoid bringing children into hospitals until the coronavirus threat subsides.
මවුරුන් ගොඩාක්ම කල්පනා කරන දෙයක් තමයි එන්නත් ලබා දීම. විශේෂයෙන්ම මාස 2, 4, 6 කියන අවස්ථාවලදී අපි එන්නත් ලබා දෙනවා. මේක තාමත්ම වැදගත් දෙයක්. නමුත් මේ වෙලාවේ අපි ඉල්ලා සිටිනවා මේ එන්නත් ලබා දීම සති 2කින් 3කින් පරක්කු වුණාට කිසිම ප්‍රශ්නයක් නැහැ. ඒක හන්දා එන්නත් ලබා දෙන්න කියලා ගෙදරින් එළියට ඇවිල්ලා සායනයකට යන්න අවශ්‍ය නැහැ. මොකද ඇත්තටම මේ වෙලාවේ මේ දේවල් කෙරෙන්නෙත් නැහැ රටේ.
කොරෝනා වෛරසය පැතිරීම වළක්වන්න සබන් යොදා දෑත් සෝදන්න.
At a time when the whole world is struggling to curb the deadly COVID-19 pandemic, which continues to tighten its grip on the world, some people here in Sri Lanka were seen taking the severity of the current crisis rather lightly as they opted to move about even though the curfew is in effect. Acting upon President's instructions to enforce curfew to the letter, police did not hesitate to strictly enforce it as they apprehended over 1,000 persons and seized 260 vehicles during the past 24 hours.
The curfew imposed in the Western Province and in the Jaffna district, which are identified as high-risk zones with regard to the spread of COVID-19, will be implemented until further notice. In all other districts, however, the curfew will be in effect until 6 am on Monday, the 30th of March, and it will be reinforced after an 8-hour window of free movement. President Gotabaya Rajapaksa yesterday ordered police and the armed forces to strictly enforce the curfew. Accordingly, the army and the police took steps to increase the number of roadblocks to 900 across the country and to check the unnecessary loitering in the streets. Meanwhile, a group of traders demonstrated against officials of the Haliala Divisional Secretariat over not issuing curfew permits to transport food items. Haliala police had to step in to disperse the traders from the scene. In the meantime, the police headquarters announced that 1,368 persons have been arrested for violating the curfew during the period from 6 am yesterday to noon today. The police have also taken 325 vehicles into custody. To date, police have arrested 5,386 persons, seizing 1,358 vehicles. Meanwhile, a mosque in Kulekada of Horopatana had held a service yesterday, disregarding the curfew, with the attendance of at least 80 people. Upon a tip-off, officers of the Horopatana police raided the venue, but by the time the police arrived, most of the attendees had fled the scene. 18 persons were arrested by police in connection with the incident, including the Maulavi and the chairman of the mosque. They were strictly advised by the police before being released on police bail. The police also mentioned that a lawsuit has been filed at the Kabitigollava Magistrates Court over the matter.
The Waqf Board of Sri Lanka, having realized the danger of COVID-19 virus and keeping in line with the national policy to prevent it, made a decision on the 15th of March and directed all trustees of all mosques to prevent having any congregational activities. We learned from the mainstream media that a mosque in Horopatana had attempted to conduct the congregational prayer yesterday. We took immediate action. We have now suspended all trustees of the said mosque, and we have also appointed a special trustee to look after the affairs of the mosque. We have decided to take very stern action against all trustees who act in violation of the direction that is given by the Waqf Board. We urge all trustees to refrain from having any congregational activity in their respective mosques till further notice, and they will be notified by the Waqf Board as and when could these congregational activities resume.
Meanwhile, a raid conducted by the Anti-Corruption Unit of the Kaluthara Division had led to the arrest of 11 persons from the area of Murunturuwa. When the officers raided the house, the suspects were in possession of a number of illicit drugs, including Kerala cannabis, ice and heroin. Meanwhile, during curfew hours, Dulapitiya police arrested 6 persons while consuming liquor in a group setting at a house in Hapualana Maradagahamula. Meanwhile, Munaragala police also arrested 4 people who engaged in gambling in the area of Vehiticula. 2 youths have been arrested by the Talawakale police for allegedly setting fire to a section of the Middleton estate in Talawakale during curfew hours. Police investigations continue in search of 2 other suspects involved in the incident. In the meantime, a group of children in Mavanala were seen running away from police officers after found to have played in a paddy field during curfew hours. Public health inspectors of the National Institute of Health Sciences in Kaluthara have sealed a private medical centre in the area which had been treating people despite the imposition of curfew. Meanwhile, security forces took steps for a second consecutive day to send home more than 3,000 workers at the Biagama Free Trade Zone who were unable to return to their homes due to the curfew. They were sent home following a medical checkup. Meanwhile, Police Special Task Force personnel were seen providing their packets of food to a group of people in the area of Jayala who were stranded due to the curfew situation. Despite instructions by health authorities to maintain a mandatory distance of at least 1 meter, traders who came to the Kudavella Fisheries Harbour seemed to have disregarded the instruction. The fisheries harbour was forced to shut down due to the place being crowded by retailers, although permission was only granted to wholesale traders. Meanwhile, the government yesterday issued a regulation only permitting the vehicles allowed by the task force formed for the management of essential commodities to operate during curfew hours. As a result, vendors transporting vegetables to the economic centre in Tamuttegama were inconvenienced. With the intervention of Minister S.M. Chandrasena, however, the vehicles were granted permission under essential services. Acknowledging that curfew should strictly be enforced, Prime Minister Mahinda Rajapaksa meanwhile has instructed the acting IGP to grant permission for vehicles transporting food items to all economic centres.
අවශ්‍යයෙන් ඔබේ මුළු පවුලම 100% දක්වා විෂ බීජ වලින් ආරක්ෂා කර දෙයි.
What sort of a role can academia and the research staff play in mitigating the current situation and contribute to a more longer-term solution in Sri Lanka? I've invited to our studios to discuss all this and also about education. The Sri Lanka Technology Campus President and CEO, and who's also the founder of the Sri Lanka Technology Campus, Engineer Ranjit Rupasinghe. Good evening and thank you for joining us in our studios.
Good evening and thank you so much for inviting me.
Mr. Rupasinghe, I spoke about research and also academic staff. How can they contribute? But before that, I think the Sri Lanka Technology Campus is one of probably the only campus that is assisting your students continue to learn amid this pandemic, amid a health crisis in Sri Lanka. You've used technology here, but my question here is how can we help across the country mitigate the impact on education as children stay at home and also professionals continue to stay at home during this pandemic while education can even continue at home when across the world we see distance learning methods being implemented?
So I think thank you so much for taking that question. I should thank for the people, those who are actually working in my university for doing that. The most important thing was the preparedness. I think we prepared previously knowing the trend towards this in the world. So that's very important. Even whatever happened during these days, preparedness is most important thing. So we actually from the day one we converted our operation into online without basically hindering any kind of a situation or operation. So we are fully online. We are delivering all our academic activities and everything online.
So everything continues without hindrance?
Everything is continuing.
For how long have you planned?
Actually, we had our setups in place. So it's a matter of instructing our staff to start delivering online and also students to be ready and take the lectures online. So we have now basically improved over the time within last couple of years into a different level in online delivery platform, so we can actually expand this to the entire country or the other institutions as well. At the same time, I must say, however we do things in Sri Lanka, world is actually moving towards that. So all leading universities in the world is now on delivering things on.
But Sri Lanka, students, staff, they're not very much open to the idea of distance learning. This is what we've seen in the past. But I know the Sri Lanka Technology Institute, the campus, has been able to implement this quite positively.
That is actually the perception that we had, and then those perception, of course, prevent us doing new things. But when we are implementing these things, people are ready to adapt towards that situation. So the perfect example is now in usual case in a physical class in my university, the attendance within 80 or less than 80% is somewhere around that.
Right.
But in my online class, student attendance is generally more than 80%. It goes up to 90-92%. So these students will definitely be ready to adapt.
How can we look at a longer term solution? Because yes, COVID-19, this is not it. We have to look at preparing ourselves. As you said, you prepared ahead when the world trend was changing. But in Sri Lanka, how can we use technology for the future and the betterment of education? And also, we know that technology, there are challenges across the country where we reach the most remote areas, but while that challenge remains, how do you propose we go about this?
One thing you asked about the technology readiness in Sri Lanka. So I think we are a country with the reasonably high penetration in 4G and 3G technology. So internet penetration is quite high. And then at the same time we have restrictions as well, so affordability and everything restrict people come online, and also the equipments that they use might not basically adequate for online learning environment. So those are things, but what we can do is we can think of alternate technologies for countries like us. So how can we combine television channel together with the proper learning platform and do a combined solution. So there are a lot of things that we can think of in a situation like this. And at the same time, what I should highlight here is it's very important that we think in long term, because we should not expect this to be finished within a couple of weeks just after curfew goes off. So the industry like education should plan for at least a semester. So that's our assessment at the moment, and that's the world assessment as well. So we are planning ourselves for at least 6 months ahead how we be online and doing our stuff. So it's very important to keeping standards in education. So those are the challenges that we actually
There is one more area I'd like to venture into. As I said, we'd like to talk about research and the help of academia in mitigating the current situation and looking at research-led innovations using technology. The Sri Lanka Technology Campus, what's the contribution here, and what do you personally see in terms of the contribution of academia and research?
I mean, what we did first, we shut down our university physically for education, but we encouraged and continue our research. And we made their contribution compulsory and the continuation of their research. And the trend is now actually most of our researchers, and not in our university, but in the most of the universities, they are now thinking of the possible contribution that they can make to the government and to the country to overcome this situation. So there are a lot of projects going on at the moment with the contribution of my staff and the rest of the staff. We are thinking of guided trolley for this hospitals, and we are thinking of developing a low-cost ventilators, and at the same time we are thinking of developing, and we are actually researching developing a low-cost or free solution for delivering online content to the school kids in the country. So I mean, now it's a high time for academia to work with the rest of the people in the sector,
and also research into medical innovation.
Exactly. So that relationship or that working together culture is very important at the moment. So I know like the medical doctors and the other people can contribute and be part of this whole thing together with academia. So and academia can contribute to their operation in a big way.
Particularly for COVID-19, I mean, we know that we talk about social distancing, but how can we use that as a technology in terms of treating our patients?
There are many ways. I think there are things happening in the country as well at the moment in a small scale, but the technologies can be used in big way if academia can contribute and join with the medical setup, which we are actually doing at the moment.
Right.
So we are trying to introduce a patient monitoring system distantly, and also we are trying to develop a system to deliver the required stuff to the patient distantly, and also to have the communication distantly with the patient. Those are the things that we can think of. And at the same time, it's very important that we think of a long-term solution for everything, where academia can be part of in a big way.
Thank you very much, Mr. Rubasinghe, for joining us. We had with us engineer Ranjit Rubasinghe joining us on First at 9. Welcome back. The Presidential Task Force on Essential Services headed by former Minister Basil Rajapaksa has decided to take steps to distribute pharmaceuticals to the public through the Postal Department. According to Postmaster General Ranjit Aryaratne, the distribution of medicine in Colombo district will commence from tomorrow, while State Pharmaceutical Corporation outlets in the rest of the districts will commence distribution activities starting Monday.
According to instructions issued by the Acting Inspector General of Police yesterday, all private pharmacies except State Pharmaceutical Corporation outlets were closed down with immediate effect. However, it was reported that the Town Hall outlet of the State Pharmaceutical Corporation had been kept open from 8 this morning, only to be closed 2 hours later. As a result, people who travelled to the outlet to obtain medication were faced with extreme inconvenience. The State Pharmaceutical Corporation outlet in Maharagama too was seen closed today, with a notice instructing customers to forward prescriptions to the corporation via messaging apps WhatsApp or Viber. In this backdrop, the police headquarters today announced that it has introduced another method for people who cannot access or order drugs through WhatsApp, Viber or IMO. Accordingly, they can do so by contacting the nearest police station. The police headquarters announced that the acting IGP has ordered OICs to make necessary arrangements in coordination with the respective pharmacies in their areas. Meanwhile, the Presidential Task Force formed to manage essential services convened at Temple Trees this morning, chaired by President's Special Advisor Basil Rajapaksa. During the meeting, attention had been drawn to developing a systematic program to distribute drugs. Accordingly, it has been decided to use the Central Mail Exchange for the distribution of medicines to patients registered with government hospitals and to order drugs from the country's private pharmacies. In addition, it has been decided to launch a special program with the collaboration of the State Pharmaceutical Corporation and the Postal Department to provide medicines to patients who need special medication, such as in the treatment of cancer.
With the closure of all private pharmacy outlets, the government introduced a special program yesterday enabling private pharmacies to deliver drugs to the homes of their customers by accessing www.health.gov.lk. The public can identify outlets offering this delivery service, sending a prescription issued by a qualified physician via WhatsApp, Viber or IMO. The delivery will be made within 24 hours. Payments can be made via cash or online and with reasonable delivery fees expected to be charged. The Ministry of Health informs the public to contact 072 0720 720 or 0720 606060 for more information. And the Presidential Task Force managing essential services has introduced contact numbers for the public to connect with their operations centre. Accordingly, the operations centre can be contacted via 0114 354 854 and 0114 733 600 for information on service requirements. Meanwhile, the Ministry of Public Administration and Home Affairs has introduced several special telephone numbers to address public grievances. You can find out more information about this by visiting their website, our website, www.AdaDerana.lk. President Gotabaya Rajapaksa today called on the chief prelates of Asgiriya and Malwatha chapters and informed them the progress of the government's COVID-19 eradication efforts. There was also a couple of donations made to the COVID-19 Healthcare and Social Security Fund.
President Gotabaya Rajapaksa called at the Temple of the Sacred Tooth Relic in Kandy this morning, where he was welcomed by the custodian of the temple, Odiyavadana Nilame, Pradeep Nilangadala. During the meeting, the Diyavadana Nilame donated 10 million rupees to the COVID-19 Healthcare and Social Security Fund. Afterwards, the President called on Chief Prelate of the Malvatta chapter, Most Venerable Tibbatuave Sri Sumangala Thera, at the Malvatta temple and explained the measures taken by the government to eradicate COVID-19.
අපි බලලා තියෙනවා 14ක් වෙනකොට ඒකට ඉතින් අපිට මේ ප්‍රශ්නේ නැති වෙනවා.
During the audience, the Chief Prelate donated 5 million rupees to the COVID-19 Healthcare and Social Security Fund. The head of state then visited the Askiriya temple and met with the Chief Prelate of the Askiriya chapter, Most Venerable Varakagoda Sri Gnanaratana Thera, and elaborated on the government's COVID-19 eradication measures. During the meeting, Most Venerable Gnanaratana Thera also donated 5 million rupees to the COVID-19 Healthcare and Social Security Fund.
The country might be in lockdown, but AdaDerana is doing its part in making the lives of the people as bearable as possible during these difficult times. Our humanitarian initiative continued to distribute essential goods to religious establishments from where goods are distributed among members of the public who are very much in need.
The COVID-19 pandemic and the curfew enforced by the government to mitigate the spread of virus have left the people facing various inconveniences. With the aim of giving them some relief, AdaDerana launched a special program. Essential foods and other goods are donated to temples and other religious establishments through which they are distributed among people. Today was no different as goods were donated to those religious establishments. In the meantime, several other institutions also joined hands with AdaDerana. The first stock of hand sanitizer manufactured at a laboratory of the Ceylon Petroleum Storage Terminals was handed over to AdaDerana for it to be distributed among state hospitals. Spring and summer, meanwhile, also extended their cooperation today by donating dry rations. AdaDerana stands ready to provide people with essential goods during these trying times via religious establishments. You too can contribute to the case by getting in touch with us on 0770 701010 or 0772 466 488.
And with that, we'll take a short commercial break to return with more news.